alert now, as odds are either you or someone you know has been sick in the last few weeks. Health officials warn that we are in the middle of what they're calling a triple-demic. Flu cases, COVID cases, RSV cases have risen over December. So could it lead to new public health measures like mask mandates? Matt Gregory joins us in studio to take a look at the latest numbers. So Matt, what'd you find out?
Hey, Allison, we saw this time last year a spike in COVID cases. It peaked in January and came down. And this year, COVID cases aren't rising at the rate they did then. But when you combine their small rise with two other highly contagious viruses, it's a sick season and hospitals are feeling it. But let's take you through what we're seeing, because we want to give you an idea of where we're looking at. So this is flu cases right across the country, and they're measured from very high all the way down to minimal. Well, if we zoom in on our area right here, you can see that Virginia right here is seeing very high cases, as well as D.C. is seeing high cases. Maryland still high, but these are going to be updated this week as well. So those numbers kind of fluctuate on the way that they look at them, right? Like it's hospitalizations measured here, it's check-ins here in Virginia, but they're all seeing higher levels of influenza-like illness. So that's the first part. Then we go over here to the COVID tracker. This is much different than last year. You can see everywhere in the immediate DMV, from Prince George's County, Montgomery County, over to, and we're going to kind of zoom in a little bit more, over to Fairfax County and Alexandria. Those are all seeing low levels of transmission of COVID. But when you combine that, right, with, say, influenza-like illness as well as RSV, you're starting to see this. High levels of hospitalization across the area. So, like, for example, here in Virginia, when you look at the numbers, 74, almost 75% of the beds are already taken up in hospitals. When you go over to D.C., same thing, except it's 82.66%. And then when we take a step out, we look at Maryland, it's about 84%. So that's the problem, because what you'd like to see is lower in the 50% and down. So what we've been seeing is that there's lots of different elements that are all playing in, these three different viruses. And that's why you're seeing public health officials like Montgomery County's chief executive looking at the potential for reviving certain COVID-era restrictions, like possibly instituting mask mandates again.
We're trying to avoid the bad outcomes so that we don't get back where we were before. We won't do anything more severe than we need to do, but if we tell you we need to do something, it's just a tool to make sure this thing doesn't go where none of us want it to go.
So what do? Health officials point out there is one of the keys to avoiding severe illness, besides wearing masks in areas like you saw, like a mall or somewhere that's inside. The number one thing which can avoid severe illness is vaccinations, from the COVID boosters to the flu vaccine for the year. All of these things help prevent severe disease should you get sick. And that's sort of what we're looking at. Allison?
Do what you do to not get sick, right? Just whatever, wash your hands, all that other stuff too. Thanks so much, Matt.